Hello everyone, I am Dr. Mohammed Nishar, plastic surgeon from Chennai Plastic Surgery. Today I am going to discuss about the muscles of the external nose. Why do we need to know about the muscles of the external nose? What is the unique feature about the muscles of the external nose? The unique features of the muscles are it is not encountered visually or even during rhinoplasty, it is not directly dealt with. And what are the muscles of the nose? So in order, there are elevators of the nose, depressors of the nose, dilators and compressors of the nose. So elevators are procerus, anomalous nasi muscle and levator labii superioris alec nasi muscle. Depressor muscles are Alar Nasalis and Depressor Septi Nasi. And compressor muscles are Transversalis muscle and compressor narium, and other minor dilator muscles are dilator narium muscles. How these muscles are arranged in the external nose? As I said earlier, it is not visually encountered, but because of the action of these muscles, we can able to appreciate the fine movements of the external nose, and this muscles helps in the breathing. Usually, this muscle is ignored in the literatures of rhinoplasty, but it is very significant because the external nasal muscles are surrounded by a sheath which is called as SMAS, something similar to the SMAS present in the face. So, this is called as nasal SMAS. This SMAS layer is very important in surgical dissection. And what is the other unique feature of this muscle is, even though there are a lot of muscles present in the nose, there is no single independent action of them. Even though more than 7 to 8 muscles are present in the nose, there is no single independent action for them. All function in a combined manner, and synergism is the rule. These muscle fibers interdigitate among them to provide a coordinated movement of the nose. For example, motion of the dorsum of the nose, nasal tip and ala are because of the combined single function of the entire muscles present over the nose. And what is the surgical importance of this nasal SMAS? It is the plane of dissection. During open rhinoplasty, the plane should be below this SMAS and superficial to the nasal skeleton and cartilage. So it provides the ease of dissection, less bleeding, and it preserves the neurovascular bundles which supply the nasal skin tip, so there will be a less scarring which provides a better results. So what are the problems encountered because of these muscles? One is overactivity of the muscles and other one is paralysis of the muscles. These nasal muscles are supplied by the facial nerve, so paralysis of the facial nerve will have an impact on this muscle. So there will be a difficulty in breathing and the absence of nasal flaring will be there. What are the overactivity present in this nose? One is because of the action of the procerus, there will be bunny lines present over the dorsum of the nose, and there are nasal flare which is due to the overaction of the levator labii superioris alec nasi and alar nasi. And because of the action of the depressor septi, in some patients during smiling, the tip of the nose will be pointing downwards. Coming to the nasalis muscle, it has two parts. One is transverse part and another one is curvilinear part which winds around the alar cartilage. So transverse part is called transverse nasalis and the curvilinear curved part it is called alar nasalis. Similarly, Procerus also has two bellies. One is medial fascicles and another one is lateral fascicles. And levator labii superioris alec nasi, which arises from the frontal process of the maxilla and gets inserted into the upper lip. It also has two fibers. One is medial fibers and lateral fibers. Lateral fibers will go to the orbicularis oris. This medial fibers get inserted into the alar cartilage. So during contraction of this levator labii superioris alec nasi, in associated with alar nasalis, there will be a alar flaring. So how can we treat these problems? The facial nerve palsy can be treated only by the encountering the problems with the facial nerve. Apart from this hyper wrinkling present over the dorsum of the nose, ala and depressed tip of the nose can be treated non-surgically using Botox injection to treat the bunny lines, ala flaring and depressor septi. Even during rhinoplasty, some surgeons to have a elevated nasal tip, they resect the depressor septi so the tip pointing downwards can be elevated. So these are all few points about the external nose and its surgical importance. So in upcoming videos, we will discuss about the other facial muscles and will bring up a new topic for discussion in forthcoming sessions. Thank you.